to success. We can do this really well, build our logic model off our assessment data. We're going to have a roadmap to really see change in our community, to start moving that needle that we want to see. I think a lot of times we get fearful of logic models because we're like, it feels very academic. How are we going to use it? And I really want to showcase how we can do this in a community-friendly way that helps us all get to where we want to go in terms of impact. So again, you've already seen this if you were with me today. Our goal is to keep everyone engaged. So I am going to be asking things in chat box. At some point, I'm going to pull up the mural whiteboard and have us go through a problem analysis just so we can showcase how you can do this in your community. Again, I really want this to be something that you take back and do with community members, whether it's with or your staff or your coalition members, so that you get a well-rounded viewpoint from different people so that you can really see how this works to bring people together and create buy-in and accountability for the problems we're seeing in our community. So we're going to do some chat box stuff, ask you to speak out some as we do that problem analysis on the whiteboard. So we want to make sure you understand the importance of the logic model and its place in the strategic prevention framework, how we can build some capacity around that. And also let's step through a logic model. Let's really talk about how we do it. So in thinking about that, I want to know why you're here today specifically for logic models. Is it that you're facing a barrier with them? Is it that you've never done them before and you just want to know how? Is it that you hate them and you want to learn to love them again? Go ahead and put into chat, why are you here today? What are you hoping to get out about logic models? I will clean my glasses as you do that because I can no longer see through them. Aubrey, learning what they are and how to use them perfect ideas to improve. New to DFC and learn is perfect. This will help for sure. You know, it's funny. I had 10 years of drug-free communities grant with our coalition. And originally, back in the day when you applied for the drug-free communities grant, you actually had to put a logic model in the application. They've gotten away from that. So I think it's always good as a new DFC grantee, if you're coming into a DFC grant that's already established, make sure you're checking in on the logic models. Just want to make sure we're not missing any best practices, looking to improve, writing good ones that will help inform the work being done. Perfect. We will hit on all of those. So again, thinking about where this fits in the strategic prevention framework, I'm going to go ahead and move to the next slide so you can see it better. It fits in that community assessment realm. So if you were with us for the prior training, we were really talking about how do we build the data? How do we describe our community, have data about them, make sure it's well-rounded? Now the idea is, what are our next steps to utilizing the best pieces of data so that we can show change in them, right? So this is really, we're starting to build our evaluation plan all the way back at the assessment stage. And so it's taking that information from the community assessment and saying, okay, let's do a problem analysis. And we're going to talk more about what I mean by that in a minute. And then create a logic model from that. And from that logic model, then we can start building a strategic and action plan and our evaluation plan off of that. So this is truly saying, what are the best pieces that we want to prioritize from the community assessment and move them into a logic model and saying, this is what we're going to be in charge with changing within all the data we collected. So it's a piece of the assessment moving us to even get more streamlined and strategic before we move into the strategic and action planning. So that's where it fits in the strategic prevention framework. And if you're with us earlier, I was talking about how it's important that we institutionalize the strategic prevention framework process. Like, we know it as a framework, and it can get very check the box for us, but it is a process, not a task list, right? We're supposed to be always coming back. If you've ever been with a CACA training back in the day, we say it's like a spiral graph. You're like slowly coming back around, going around until you come back to the assessment. The logic model is a critical piece of this because it truly should be what you're basing everything off of. I used to post the logic models for my coalition around my desk because I would remind myself, if we're doing something and it's not directly related to impacting something on that logic model, why are we doing it? It's either that we need to update the logic model or we need to not be doing it. It's different if it's like building capacity or something like that. That's in a different box. But if we're doing some type of implementation, some type of strategy that's supposed to be impacting substance use, and we're not linking it back to impact on our logic model, then we're not aligning to change that data. And so what I really want you to get out of this is that if we get good at this, we'll get better at our strategies, and then we can make sure we're showing we can move that needle so we can get more and more funding. So here's the logic model that we like to use at CATCA. The reason is not because it's perfect. It's because it's the easiest for communities to use because it fits on one page. We call it the 2x4 logic model because it has the 2 root causes. So right here, you see favorable parental attitudes and availability of alcohol and 4 local conditions. It fits nicely on one page. It's easy for people to understand. It fits right, comes right off of problem analysis into this, which I'm going to showcase. So it really doesn't matter. If you want to use circles, use circles. If you want to put flowers in there, that's fine. The idea here is we're unpacking it, right? We're taking a very large issue. And that's what's important with this, because we get into communities and we'll see something like underage drinking being the issue, right? We're like, we need to handle this. And it doesn't matter whether you live in rural area of like Nebraska or you're in a big city like Los Angeles, underage drinking is an issue, right? So we have to unpack that. We can't take on that whole elephant by itself. We have to figure out a way to get it into more digestible pieces. And that's what the logic model does. It's untwirling that ribbon, right? The big bowl of yarn. We're trying to make it easier to deal with, because what are we going to do to take on underage drinking? Right? We could have things all over the wall of things we're going to do to take that on. But as we start to unpack, but why? And we start looking at favorable parental attitudes. And then we start looking at what does that look like on the ground level? And we're saying, well, we're seeing parents drink at high school football games. We can get more and more specific with our strategies to start impacting that bigger elephant that we're seeing, that bigger problem we're seeing at the end. And that's why logic models are so influential to our work and why we should be utilizing them. I remember when I first went through my first National Coalition Institute when we had gotten our drug-free communities grant. One of my very dear friends was my board chair at the time. And she said, you are always so cool-headed, but I have only other time I've seen you frustrated is when you were doing logic models. She's like, because the instructor kept coming back and being like, but why here, Christina? But why here? Can you unpack that a little bit more? And I was, not gonna lie to you, I was frustrated. But once I stopped getting frustrated and reached through to that next aha moment, I really saw how this could change the way we were doing work. Whereas before I felt like we were all over the place, this really made sure that I knew the exact data that I was impacting at the right time so that we could show movement. And I ended up coming back so excited. I wanted to do this work. I wanted to logic model. I came to the next coalition meeting and I'm like, we're going to logic model, everyone. I was like Oprah. I was like, logic models. And everyone looked at me like I was crazy. I'm not going to lie to you. Everyone's like, I don't know what you're talking about. You're scaring me with these words. So one of the other things I'm going to talk about is how we can bring this to our coalitions or our prevention groups and teach them how to logic model without actually teaching them how to logic model. So how can we give them medicine and sugar at the same time, so to speak? Because this can be something that we actually are doing and don't realize we're building logic models. So we're going to go through how we can do this in like a way of telling stories. But where do we start? So as I mentioned, you have your community assessment, and within that is your needs assessment data. And so from that, you have a wealth of knowledge already, and you've already decided a problem you're going to tackle, like underage drinking. The idea here is to make sure that we're still seeing the whole perspective we want to see when we go into a problem analysis. You already have some data. So like I said, you know alcohol is a problem. You might know availability is an issue, but maybe you really haven't looked at all the different ways that this is showing up in your community. A problem analysis helps root that out. So the goals of a problem analysis is to understand the relationships between community issues. So again, how does underage drinking relate to availability, relate to the fact that parents are drinking at high school football games? Like, how do we mapping out all the behaviors we're seeing? It allows us to unpack to those root causes. You've already done some of that most of the time in your needs assessment, but sometimes there's some hanging fruit there that we still need to work on. It allows us to validate what we're seeing in the community data with a group of people, get consensus among our members, and create a picture of the problem and its causes. And that's what will become the logic model. I love problem analysis for its consensus building as well. And as we talk about this, I know if any of you have been in coalition work long enough, you will have what I will refer to as a Ronnie. I use Ronnie because she's a dear friend of mine. and she was in my coalition. And Ronnie was always the person who would come up with things that were they would hit half the time, but other times they'd be in left field. And you'd be like, Ronnie, come back, bring the train back on the track. But she'd be thing like this and be like, why are kids using cannabis? Tell me more about it. Tell me the story of the use. What are you seeing? Like, again, trying to start this process of unpacking these issues so we could do a logic model. And she would, without a doubt, be one of the ones, and she didn't actually say this, I'm being off the wall, but people say things like this, be like, well, it's just because we don't have enough macaroni and cheese. If we just had more macaroni and cheese, none of our youth would be using substances. And what's great about something like a problem analysis is it allows us to put something like that on the wall. And you're going to see when we do this on the whiteboard and say, okay, Ronnie says macaroni and cheese is the issue. Let's put it up there. And then say, okay, how many of our young people are really having that issue? Do we have the data to back up macaroni and cheese in the issue? And slowly those things start to fall off the map. And we start being left with the stuff we know we can back with data and that we know multiple people are saying. But at the same time, Ronnie feels heard and supported, and she's part of that consensus building. So where do we start when it comes to starting this problem analysis process? And like I said, the idea that we should have partners at the table to do this work. And if you are a drug-free communities grantee, you know these beautiful 12 sectors. I will say, these are a starting line, not a finish line. I think we get we pigeonhole ourselves into being like, I have a youth, check the box. I have a parent, check the box. These are just saying that we need at least these sitting at the table to say we have a coalition. But we need to make sure we have diversity in our parents. We need to make sure we're looking at multiple media people. If we have multiple school systems, there needs to be representations from those multiple school systems. We need to look at different layers within the school systems. Do we have teachers represented? School counselors, administration? So this is very much a starting point, not a finish line. But very important as we start to do something like problem analysis, because we want to hear from all these people. So we mentioned with community assessment, you're tapping into these people already when you're asking for data. So when we're starting to figure out what are the data points we're really going to focus on, or if we have holes in those data as we're doing a problem analysis, we want them at the table. And there's many different ways that I've seen this facilitated, what we're about to get into in terms of problem analysis. You can have the sectors by themselves, like youth working on this, or just bringing parents to the table, or you can just break into groups within your coalition meeting that has a little bit of everyone in them. The idea here is that everyone gets heard and that we're asking questions about like, what does it look like? Tell me the story. This is where that storytelling comes into play. They don't need to understand every type of risk factor. They don't need to understand what we mean by local conditions completely. You're doing that by asking the right questions when you're facilitating this. By saying, okay, we all agree cannabis is an issue, but why is it an issue here? What are we seeing? Law enforcement, tell me what's happening when you're like, what does it look like? Where are they at? We just start asking those questions and telling those stories, then we can start putting it into place, matching it with the data and deciding what moves eventually to the logic model. So the first part of building that logic model, again, is this problem analysis. And we just call it the but why here version. There's lots of different versions. I'm sure you've seen there's a fishbone one, there's an ABC one. This one's just the easiest, like I said, to throw up on a whiteboard or to be doing with Post-its, or if you have chart paper, that I feel like is really helpful to use when we're doing it in a community setting. And the idea here is we're putting the problem in the center, whatever that is, alcohol, cannabis, meth, whatever it happens to be. And then we're saying, but why? Why is alcohol use happening in our community? What is making it more likely? And then finally, but why here? What does it look like on the ground level in our community? If I could take a picture of it, what would that picture look like? And that's where we get into the local condition. Again, availability is an issue across the world, across the United States, but what availability looks like in your community is going to be very different. Now, here, thinking about the coalitions I work with across the United States, some are dealing in snow communities where people are skiing, where young people are skiing into different like ski resorts, like people who live near them, into their garage and taking beer out of the garage. Other people are living on rivers with high tourist area where people are sharing on boats. All of that is really specific to the area in which you live. And that's what we're really trying to get to as we build out those local conditions. So I want to start by what I mean by building a picture, because this is where I feel like we overcomplicate it, because we start with the data, we're like, let's unpack it. And then people, myself, get nervous. And I say that because as soon as you start bringing numbers into it, a certain amount of people tap out. But if we ask people to tell a story, what does this look like? Tell me what prescription drug use looks like. We can start taking that and building out that problem analysis and then matching it to the data. So let me tell you what I mean by this. So again, telling a story. Man, I really want something to take the edge off today, but I don't want to do anything illegal. Well, let's see what kind of pills we can find in my grandparents' medicine cabinet. They have so many, they won't know they're gone. These round ones may be painkillers. Let's give them a shot. And then 2 days later, they're at school and they're saying, ugh, I feel horrible. And a classmate saying, hey, I've got something that can help you out. I think try these. And they're saying, okay, thanks. So what are we seeing in this picture? What is the drug of choice that we're seeing, either unmute or in chat?
Prescription painkillers.
Okay, prescription painkillers. And what's happening around here? If we had a root cause, what are we seeing going on in this? Where are they getting them from?
Family.
Getting them from family. Okay, so analysis,
Medicine
access, unlock meds, grandparents. Okay, and what else do you see with the two young people at school? What's happening there? So they're
Well,
sharing. Go ahead.
They need to, I mean, the strategies they're having to release stress is, taking the edge off. So, what other strategies could they use instead of looking at it to a substance?
Yeah, Lisa, you're exactly right. So they're showcasing right now that they're sharing prescription medication. They're doing it. You're exactly right, because they're trying to self-medicate for something. And then on top of it, you see where this person is not like a drug dealer or someone who's purposely trying to do something to hurt their friend. There's a perception that there's not going to be harm, that I'm actually helping, right? So there's a perception of harm issue here too. So what we're seeing just in this story, and this is something we can easily pull out of our community members as we're talking to them. Hey, what does this look like? What have you heard? This could easily come out. And just right here alone, we see the issue is prescription drugs. And then we're seeing two root causes, perception of harm and availability. And we're also seeing that they're sharing at school as a local condition, and that we have unlocked and unmonitored cabinets at our grandparents' home. So just in this, you already started doing a problem analysis, right? So we know the drug of choice is what becomes the problem statement, or if we're doing a problem analysis, that circle in the middle. The two main issues that we're seeing are the root cause. So here, just if you weren't with us earlier, these are the root causes based in prevention science. What we mean by that is the ones that we know through the research with tobacco and alcohol move the community meter. Okay. And so that's why we focus on them. Are there individual ones? Absolutely. Are they important? Absolutely. We focus on these because these are the ones, as we're building a community logic model, we know will make that needle shift, that move we want to see in the overall community in their substance use. And so from that prior example, we see that we're seeing social availability from the medication, the grandparents' cabinets being unlocked and unmonitored. And we're seeing that favorable youth attitudes. And what I mean by that is they don't think it's harmful. They think they're doing anything wrong by sharing their prescription drugs with their friends. So again, sorry, I was going to sneeze. We want to ask ourselves when we're looking at that story, and as we would be unpacking this with our community members, how are youth using? Where, when, and with who? So again, our job as prevention professionals is to be asking these questions. So what is the drug of choice? What are the two main issues that are opening up to that choice, which we saw availability in youth, favorable attitudes? And then finally, how are the youth using? Where, when, and with who? And this is where we see youth are stealing prescription drugs from grandparents' medicine cabinets, or unlocked, unmonitored. I actually like better because it doesn't seem so blamey. So thank you for putting that in chat. And then youth are sharing prescription drugs with friends at school. So we're seeing it's youth are doing it. We're seeing they're doing it at school and they're doing it with their friends, right? I think it's really important what Lisa said. And that's why it's important to break down this picture so much, because now if we just said prescription drug is the issue, we would just be putting mud up against the wall once we get to strategies. But here, as Lisa was pointing to, now we know, okay, we're having an issue with young people knowing that they're harmful to share prescription medications. They're also struggling with their mental health. So what services could we bring in to assist them with this? And it allows us to get much more targeted in what we're doing. And what I can tell you is when we started to get really good at this, and target, and this comes right from our logic model back in the day, we were able to reduce prescription drug sharing in school by 50%. We were able to see a 25% drop in prescription drug use, all because we started targeting the mental health. We started talking to parents about locking up their meds. We had a whole strategic approach. But if we hadn't broken it down this way and hadn't gotten here, we would have just been throwing mud up against the walls, being like, where's availability coming from? Why are they have favorable attitudes? And I go back when we first started diving into this data, so many people are like, they're just using to get high. But when we got the data, it was less than 3%. Most of them were doing exactly what Lisa pinpointed, which is they were sharing to substitute for mental health issues that they were having. They were struggling with depression, they were struggling with anxiety, and they didn't know what they were doing. They're just going in and trying to find something to make them feel better. And they were sharing prescription drugs as a way of helping each other community doctor, for lack of a better term, not because they were trying to get high. And so that's important for us figuring out strategies later on and figuring out how we can move the needle on changing prescription drug use overall. And that's why these logic model conversations are important. And again, people don't need to understand all the nuances of like what I was just talking about in terms of root causes and local conditions. You as prevention professionals do, you just got to get them to tell you the story. And that part is actually really fun when you get into groups. And then you can figure out, where do we have data to back it up that's in our needs assessment? And if we don't have it in our needs assessment, where do we need to go to get additional data to make sure this is something we're really seeing? Any questions or something you'd like to add there if you've worked on problem analysis or logic model? So we're going to go into a problem analysis working all the way through the bubbles in a minute, but I do want to, the problem analysis and logic model steps are interlinked. As you can see in the upper right-hand corner, you're getting the data from your community assessment is helping inform this problem brainstorming session that we call problem analysis, which then informs the logic model. And we want to make sure that whatever we move to the logic model from a problem analysis is based on data. So like I said, it doesn't matter how advanced you are as a coalition, whether you are 25 years old or brand new. Once you start doing a problem analysis, you are going to find holes, no matter what you have in your community assessment, especially if you're doing this right, because things change, right? And the local conditions are definitely changing. And so odds are you're going to have to ask a few people if they're seeing it, do some listening sessions, something like that, maybe an environmental scan to confirm what someone might be telling you. For instance, we were talking about, we had an issue with a bus stop. There's a report of lots of drug sales happening at this bus stop, and it was an elementary school bus stop where adults were coming in and doing things they shouldn't be doing at the bus stop. And we had just heard that from a community member when we were working through a problem analysis. We had no data on that. So then we had to go talk to law enforcement. They started like going around that site, seeing what was happening. We were able to figure out it really was going on, have some data points for it. So then we could build a plan around how we were going to better enforce and see what was happening around that site. So you will find holes. It's normal no matter how advanced of a coalition you are. One of the things we want to check for as we're moving from problem analysis to logic model is that our root causes are based in those prevention science. And so there's lots of different ways that's going to come out, and we're going to see this as we model a problem analysis, where people are going to talk about things like peer pressure. Why is it happening? Because families aren't together. All of those things. It's then our job to be like, okay, this would fit into favorable attitudes. This might fit into community norms. And then we start to put it into those larger buckets of those root causes. We do want to make sure those local conditions, again, are specific, identifiable, and actionable, which means that we want to be able to take a picture of it. I want to know it as a behavior on the ground level, not a thought bubble. So sometimes it's helpful when we're thinking about this to remove ourselves from the substance use world. So I want to put you into safety world, traffic safety world. There is not that long ago that you could leave the hospital with your child not in a car seat, right? Now, before you can even like think about getting to leave the hospital, you got to prove you have a car seat, that you got to put them in it. Then you get into the car, you have to buckle up. If you don't, your car is going to make an obnoxious beeping noise at you. As you're driving that child back, you're seeing road signs about buckling up. There's enforcement if you got pulled over and you weren't wearing your safety belt that you're going to get in trouble. All of those things, right? Those are behavior changes we want to see. We want someone to be buckling up. Not just that they don't care. I don't like, they might not like it. They might think it's the most ridiculous thing ever, but they're going to do it to stop that car from making that noise, right? So we want to move from the thought bubble to actual behavior we're seeing on a ground level when we're talking about local conditions. So the fact that I could see kids drinking alcohol at the pit on the weekends, that's what we want, right? That's what we're talking about when we're local conditions. I can physically see the behavior we're going to be intervening in. Identifiable means we can measure it, and actionable means we can do something about it. Because without a doubt, as you do a problem analysis, and it's not wrong, but it's going to come up, people are going to talk about the impact of music or what people see in the movies as something that's impacting kids' substance use. The problem is I can't stop Brad Pitt from smoking in his next film. I mean, if I had his number, I would call and ask, but the odds are I can't do that. So is it something that really belongs on our logic model? It needs to be something that we can impact. So if we're going to tackle something like social media, is it something locally we can do? Is it that we're going to move to do something where kids don't have their cell phones in school? I'm not saying you should do that. I'm just saying that we have to be really thoughtful about what we can actually be actionable with and what we have control over in terms of things like the media. And then, of course, that the logic model is something your community wants to take on. Logic models can be beautiful. They can be scientifically perfect and make sense, but if no one wants to do anything about it, it doesn't matter, right? So this needs to be something the community has buy-in for. So let's talk through the components of the problem analysis, and then we're going to do one together. So first, you have your problem statement. This should come directly from your community assessment. So remember, the last part of your community assessment that you're tying up with a bow is saying, this is what we're going to tackle. So we've decided alcohol and prescription drugs, whatever it is. So it's going to be based on your community assessment, and it has to meet the criteria for good problem statement. What does that mean? It means you're naming one thing at a time, one population, and that you're not blaming anyone. We're not saying if parents would just stop doing X, Y, Z, we wouldn't have people drinking. We're just simply saying the problem is youth underage drinking. So that goes in the first circle. Then we ask, but why? But why is underage drinking happening? And this is the ones, again, they should come from your community assessment. So hopefully you already have some of those in there, and they should be supported by prevention science, meaning it's that those social and retail availability, community norms, laws and enforcement, that list that we showcased earlier, right? So we're saying alcohol is the problem, but why? Why is alcohol the problem? So we're starting to peel back the layers. So these are those root causes or risk factors. You're going to have this, but you know, I might screenshot it just so you have it in chat when we're going through the next section. That's actually a good job. Just give me 1 second. That way you have it as we go into practice mode. Oh, it's not letting me do that. It doesn't like me right now. And then finally, we have our local conditions of but why here. Can you take a picture of it? Can we measure it? And can we do something about it? So again, it's the unpacking of the boxes. We're tearing apart the layers of the onion. However metaphor you want to use, we have to take something that's a huge beast to take on and break it into digestible pieces so that we could slowly start to impact that problem in a really strategic way. So here's an example of that. So underage drinking is our problem, but why? So here we have favorable youth attitudes. So we're saying that it's because you think it's okay. They don't think it's harmful, whatever, however you guys have it on your student survey. So talk about it. And then we're saying underage drinking, but why availability? It's just so easy to get. And then we would keep going with another root cause. And again, we're going to practice this in a minute with cannabis. Oh, somehow I lost the extras. And what you'll eventually see is as we're doing the problem analysis, you're going to be mapping it with data. So first, before we get into that, I wanted to pull out, I'm going to stop sharing for a minute, and then bring up my whiteboard. One second, I got to make sure it's on the right page. My Zoom page is up right now. All right, now it should be better. All right. So if we are going to do a problem analysis, like I said, there's no wrong answers here. And we're talking about in our community, cannabis, marijuana, however you refer to it in your community is the issue. Our youth are using cannabis. Our 30-day youth rates are out of the world, okay? So, but why? Why is cannabis a problem in our community? Why is it happening?
Maybe a new dispensary just opened.
Okay. So looking at availability. And don't judge my spelling. Okay. And then we're saying more dispensaries. What are some other reasons? Oh, I see in there legalization. What else? Tell me a story.
All the kids I know are doing it.
Everyone is doing it.
Well, we hear a lot that, you know, it's natural, so it can't be harmful for you.
Natural, so not harmful. All right, see, reduced perception of harm because it's legal. Bubble. Anything else? So in thinking about this, if you're doing it with your community, and again, that you are the subject matter expert, they don't need to know where to fit it. We put it all out there and then we say, okay, perception of harm means they don't think it's bad, right? They don't think it's going to do anything to hurt them. So can we agree that natural, so not harmful, kind of fits into that perception of harm piece? So then we could say, okay, we're saying the same thing here, right? And also it might be, sorry, I don't know why that thing decided also wanted to go all the way over there, but I'm moving just that. That's fine. It's all together. We can also say, depending on how your community survey is, every kid is doing it. Looks like peer pressure, which is favorable youth attitudes, which usually also falls under perception of harm. It depends on how you word it. So it could be favorable youth attitudes would very much fit here. So we could be looking at this as favorable youth attitudes. Now, Julie, you said legalization. So in chat, or if you want to unmute, tell me more about how you think legalization is impacting cannabis use. Or anyone else that also feels that way. I'm open.
It just increases normalizing use.
Okay. And is it because they're seeing stuff everywhere, or what does it look like? So if legalization is our issue, what does it look like on the ground level? What are kids doing because everything's been legalized?
Well, their access is improved, and so that impacts behavior.
Yes. Okay, so exactly. So when we're looking at legalization, is another one of those big buckets. And without a doubt, no matter what community I am that has legalization, this is going to come up. What I say is how are we going to unpack what this really looks like, right? So this could fit into easily laws and enforcement as a root cause, or as Julie, you also brought up as well, is legalization is increased availability. So where do we want to target this? Where do we have the most data? So right now we could say, okay, it's impacting availability, so let's talk more about this, but it also could be that it is like a laws and norms issues, and maybe we have holes in our laws. So tell me about if you have holes or anything in your laws. What does laws and enforcement look like around legalization of cannabis in your areas? Zoning around schools. So is that a problem? Like, has that been done well or no? This is a safe space. I'm not going to tell anyone. Anything else other than zoning around schools when we think about it? What about how it's promoted? Do you guys have restrictions on where it can be promoted?
There are some restrictions, but there's still a lot of advertising.
Okay.
So I would say that like promotion is kind of everywhere.
Thank you. And then also there are laws about proximity to school, and when students walk by the dispensary on the way to school, it reduces, yes. It reduces perception of harm and increases access. Absolutely. So zoning is a huge thing. And again, some of this is art and science of where it ends up on your logic model, because it could be that we want to look at laws as enforcement and look at advertising zoning rules through that. It could be that price and promotion by itself is a huge root cause, and we want to tackle that by working with local retailers. So some of this is an art and a science. I do want to go back to talking a little bit more about availability. So we talked about they're getting it from, when we say more dispensaries, do we know young people are actually getting it from dispensaries? How are young people, if we're thinking about young people getting their access to marijuana or cannabis?
Maybe they're getting it from older kids, or they're getting it from the adults in their life, because now that it's, legal, then it becomes more normalized, like alcohol use has. Or they found a dispensary that doesn't adhere to the the laws that they can't sell to that age.
Lisa, thank you. So it could be, like you said, like social availabilities where now it's illegal for parents and older near peers to be getting it. So they're providing. It could be that they're not providing it, but young people know they can access it, so they're stealing it from their parents or near peers. Or it could be more of a retail availability, like we're talking about, and they're actually, the more dispensaries aren't carding and youth are attaining. All right. And finally, I want to kind of talk through this perception of harm, youth favorable attitudes piece, because this, again, I love doing this with cannabis because of the things around legalization and around perception of harm, because without a doubt, you're exactly right. It has been sold that it is not harmful. It is natural. It comes from the trees. They're not going to be hurt by it. So and that's where, when I was talking about thought bubble, that is a thought bubble, right? They think it's not going to hurt them. They think that it's natural, not harmful. Because they think that, what is their behavior? Okay. So when and where are they using, because they don't think anything's going to happen to them? And as you're thinking about that, I'm going to look in chat. I said, I don't think dispensaries in our area are selling to underage youth. However, more hospitals now have cannabis. Yeah. And this is what's important, Alice, of like, that's why it's going to look different in every community. So we could be in a state that doesn't have as much regulations and they are getting it from dispensaries, or we could be in a place that it's really easily accessible by all the adults. And so they're like leaving it out, just like with prescription drugs, and young people are taking it, or adults might be sharing it, which I have seen as well. Fran said gas stations and convenience stores can sell Delta 8 to young people unregulated. So yeah, another huge issues is all the Deltas, especially someplace here in Tennessee where we don't have legalized cannabis in any form, but we do have Delta 8. And it wasn't until July that they actually put an age mandate on it. So it was anyone can come in and buy it. We finally put a 21 age limit on it in July of this year. So that's definitely something to be thinking about too, is when we're looking at this logic model, when we say cannabis, are we talking about all the deltas? And so then in the local conditions, we want to talk about the availability of something like Delta 8 THC at the local gas stations. But I want to bring back to that perception of harm piece, because again, how do we impact the fact that it's natural and not harmful? Our strategies are going to be really limited. So about the idea that they don't think it's harmful, where and when are they using? Where do we see, if we're talking to people, when and where are young people using cannabis? Alice says, according to my teens, the school bathrooms. Okay, yes, that's exactly what we're talking about, right? So this is again why building capacity during this process is so important, because we need school and youth involved to be getting this type of information. So then we want to say, because they don't think it's harmful, because they're not going to get caught, they're openly using in school bathrooms.
And also maybe related school events, because lots of kids congregate there, like football games and that sort of thing.
Yes, at school events such as football games. So a very specific one in our community when tackling cannabis was, we have the school, there's a side street right next to the school, like it's like a dirt road side street that connects to a storage unit. And without a doubt, the kids would leave campus during the day where they could easily sneak out at lunch. They would go behind the storage units. That's where they would be drinking or smoking, and then they would come back to campus. Or maybe it's happening in the parking lots. We got to get really good at where we're seeing this happen, because again, this is going to help us align strategies later on. I am not saying that it's not accurate that you think that it's natural and so it's not harmful. I'm saying that we have to unpack it more so we can figure out strategies that's slowly going to impact that thought bubble about that it's not harmful, or at the very least that they are going to get caught if they do it, and there's going to be some type of consequence for it, right? So just like the seatbelt things, one of my brother-in-law still doesn't like that he has to wear a seatbelt, but let me tell you, he buckles it so he doesn't have to hear that noise, right? So it's going to take time to change that thought bubble, but we can get them to at least stop smoking behind the storage unit or going to football games. So we put the right strategies in place that can have that domino effect. So this is where, exactly like I said, it is a conversation. Ask people more questions. What do you mean by legalization? What do you mean that it's not harmful? Tell me what that looks like. When and where are they using? We're asking all of those questions. And so from here, this is the messiness of informed brainstorming, that is problem analysis. From here, we say, okay, where can we back this up with data? Where do we have the data to prove this is happening? It might be we never thought about the fact that they're openly using in school bathrooms. This is the first time that Lisa, the school counselor, came to our event and told us that's happening. And so then we can go back and say, okay, can you show me like some reports that you know this is happening? Is there a way we can, they're seeing people smoking in the bathroom, whatever it is, so that we can back it up with data, because we don't want to move it again to our logic model until we have the data to prove it. Anything else you guys would like to add as I pull back up the slides? So again, what we're looking to do is move over to the story of the logic model, taking what we saw, like that comic strip or our informed problem analysis, and move it over here. So what we just saw with alcohol, going back to our alcohol, we saw that availability and youth favorable attitudes. And again, youth favorable attitudes is used very interchangeably with perception of harm. It really is about how you ask it on your student survey. But here we're like, we're looking at prescription drugs. They're saying it's coming from the parents' medicine cabinets. The youth are sharing prescription drugs at school. And then look, youth are sharing prescription drugs at school again. Should it be in the same place twice? No. So this is where I go back to it's an art and a science. You have to figure out what makes the most sense for tackling this with your community and what they're ready for. So youth are sharing prescription drugs at school is true. It is happening. It's an availability issue, but it also is an issue of showing that you think it's okay, that they don't think they're harming their friends by it. And so really this comes into how do we want to tackle it in terms of strategies later on and what data we have to back it up, where we're going to place it on our logic model. For me, I tend to go towards youth favorable attitudes because I want to be figuring out why they think it's okay for them to be sharing. What is really happening there? Can we build in some of the more of those mental health things? Because when we're looking at something like availability, it's just about cutting off access, which I'm not saying that's not important, but are we really getting to the root cause, which really, when we look at that picture, is pointing to that self-medication piece, right? So sometimes they could fall in the same bucket. Then strategically, you have to say, with the data we have and what we can take on, what we want to do, where does it best align on our logic model? Because there's going to be times where it feels like it fits in both places. This is where as I mentioned, that I would get frustrated when I was working on them because I'm like, but why? Just tell me where it goes. It really just depends on the data you have and what you want to take on, where we're going to place it on our logic model. So again, if it fits in place, ask yourself to bring it back to the data. What does data show in terms of low perception of harm or high favorable attitudes? Does the data illustrate sharing as the source of availability? So here we see the first source of availability is actually coming from those unmonitored medicine cabinets. So it makes more sense for us to shore up that and then work on the prescription drug sharing as a favorable attitudes issues. Go back to asking yourself why they're sharing. So again, we're unpacking so we get it in the right place. And then where can we have our biggest impact is the second part I want you to think about. What is the community higher more capacity to create change? Sometimes when we're looking at something like favorable parental attitudes, it takes a little bit more time to make that change or community norms, right? People might not be willing to take on the fact that we have a community issue around alcohol use, thinking about everyone using alcohol. So taking on the availability piece for young people, they're more likely to jump on. So later on, you can work on the community norm piece, right? And so this becomes like a strategic move for you of where it should go. But it's going to happen at some point. You're going to be looking at a logic model, like it could go in two places. Come back and ask yourself these questions, bring it to the data, and which one can we have the biggest impact for? For those that have worked on logic models, have you run into this when you're starting to move things over to it? And is there any particular one example that you have? Again, this is talking about, we've seen this, talking about the same comic strip where they're using school, what is the best fit? And what we're saying here is that we really think it is youth are sharing prescription drugs at school is the best fit for this, because it allows us to take on availability as that first piece from the medicine cabinets. And then the second piece being that youth favorable attitudes. And we're going to work on youth sharing prescription drugs at school. This was the most strategic move with the data they had and the information they could have the biggest impact with. Any questions? So again, as we're getting down as we're working towards a logic model that has line logic and is beautiful and that we can have impact on, the place I see coalitions and people working on logic models struggle the most is when we get to local conditions. Because oftentimes we continue to put the thought bubble there instead of the behavior. So if you leave with anything today and you already have logic models, I want you to go back and look at those local conditions about the but why here. And I want you to ask yourself, is it specific, again, that it's a behavior or condition that's observable? I cannot observe that someone does not think marijuana is harmful. I can observe because they don't think it's harmful that they're sharing at school or they're using at football games or they're using in certain parks, right? We want to make sure we can measure it. Does it occur enough that we can measure it over and over again? This is again comes back, if you go back to your logic model, so you're creating a logic model and social media continues to come up, which it will. Social media without a doubt has an impact. Can you measure it? Because again, we don't want to put anything in the model that we can't directly measure our impact by. So I'm not telling you to remove social media from your logic model. I'm just saying, do you need to drill it down or unpack it more to get it to a place that we can really measure that impact? And is it actionable? Can we do something about it? Can strategies be implemented that will change that behavior? Again, music has lots of things in it, without a doubt, is impacting our young people. But am I going to be able to change Lil Wayne's next song? No, right? But what are other ways we can look at this issue that we do have control over, right? And what I go back to, and again, this is where, remember my instructor saying it over and over again to me, as you're looking at those local conditions, if you're having trouble, just keep asking yourself for the story. But where is it happening? When is it happening? What occasions is it happening on? So here you have an example of underage drinking to the left, and we're saying that it's favorable youth attitudes. And so how do we know that parents have favorable youth attitudes? But why? Parents are hosting graduation parties with alcohol. So where is it happening? At parties, when they're hosting it at graduation time, and that's also the occasion, right? So we know when and where it's happening, at their homes, at graduation, and parents are doing it. So we really want to try to get as specific as possible to our community. So even when I say things like open air use in a park, tell me what parks it's happening at. If we're talking about there's a lot of social hosting happening, where is it happening? Is it happening all over the community? Is it happening in certain communities? In mine, it was actually our higher socioeconomic status that was really bad about hosting those parties. So it was actually higher in our Tullahoma area than it was in our Manchester area. So just really thinking about getting specific about where these things are happening so that you can do that actionable piece, which is implement strategies to change. Because that's what we're trying to do, is get to where we're going to have really good strategies that are going to impact that local condition, which will impact that root cause, which will impact that problem statement. We want to start seeing that domino effect. And thinking about this, I have an engagement tip at the bottom here. Provide coalition members with key data points. So this is something we did, is you're thinking a way of doing problem analysis and bringing this back. Another way we did this is with learning maps, which don't make that sound more complicated than it is. It really was that we put down some of those key things that were from our community assessment, from the needs assessment section, on the main topics that we are taking on. So at the time, it was alcohol, inhalants, and prescription drugs. And we had key pieces of consequence, problem data, etc. there. And then we had them pull out the ones that bothered them the most, and then ask them to draw what it looks like in the community. Why does it bother you so much, and tell me more about it. And so even if we didn't have all the data yet to get to the local conditions, which we didn't, this was our way of drawing it out. It allowed them to start telling us the story, another way of drawing out what we could uncover in terms of those local conditions. So it's another way of doing it and getting people involved. This is an engagement tip for capacity building. So again, this is what a full 2x4 logic model looks like. So first we want to fill in the boxes, taking from the problem analysis, the circles. All we're doing is moving them from boxes and making it more streamlined, because that was a mess, right? We were just throwing stuff on, whatever you guys were saying. I wanted to make sure you were heard. And then slowly we started building consensus of what we were looking at. So that's what becomes in those first set of boxes. So here we're looking at underage drinking. Then for the 2 root causes, it's favorable parental attitudes and availability of alcohol. And then we have 2 local conditions for each. The next, like I said, is we have to match data to it, right? We have to have 2 pieces of data. If you remember, you're with us for the assessment workshop, we want to triangulate data. We need to have more than 1 piece of data proving what we're seeing to make sure that, yes, this is an issue in our community. So we want 2 pieces of data for each one of these elements. It would be great in a perfect world if they're a mix of quantitative and qualitative. So realizing that in the beginning of our logic model, we're talking about problems and moving into root cause, they're going to be heavier on the quantitative piece because they're probably coming from one of your surveys. And we're going to have more qualitative in our local condition piece. It doesn't have to be that you have 1 quantitative, 1 qualitative under each piece. It's the idea there's a mix throughout, knowing that it's going to lead to more, because local data is going to be more of the qualitative data as we get farther into the logic model. we want to make sure that we're collecting data at multiple times. One of the issues I see a lot of times when I see developed logic models is there's such a heavy reliance on student survey data. So like I said, I love it, but usually you only get that every 2 years. We want to be able to see if we're making impact before that, especially on the local conditions. So is there a way we could be getting data more readily from police or from interviews or from local youth focus groups or listening sessions that we can tap into seeing if we're making changes in 6 months to a year? And then remember, this is your roadmap, because Lisa might win the lottery and she's going to move to Bermuda and she's going to be gone and someone else is going to take her job and they need to know how to do it. So this is a roadmap that anyone else can pick this up and know where we got the data from, what it's mapped to, so they can go and run with it. So in 6 months, they can be like, oh, they went to the Coffee County Sheriff's Department and they got this report looking for this data, right? So you're going to see where this comes in with more detail for the data points. This is just giving you a snapshot. But so we want to make sure the data has the measure, meaning the question asked, so like 30-day use rates, the actual data point, so like 7%, the source, so what survey it comes from or what department it came from, and the date in which you got it. Usually like a month and year. We don't need to know July 25th. And again, this is to make sure we can go back and ask the same group. So if we're doing something like key informant interviews, we could say we talked to 7 out of 10 law enforcement officers at these 2 departments in July of 2025, so that we can go back to the same roles. They might not be the same people, and make sure we're getting that information. Remember that we want whatever data that we map to the logic model to prove whatever is in that box. So what do I mean by that? If I say the local condition is parents drink at high school football games, both that police report and that youth focus group specifically tell me that parents are drinking at the high school football games, not that just parents drink or that a parent down the street from the football game was arrested. I want to know specifically that the police reports are saying that parents were arrested or got in trouble, cited, whatever, for drinking at the high school football game. I want that youth focus group to tell me that 8 out of 10 kids told me in a youth focus group that they see parents drinking at high school football games. Because the idea here is we're going to have a set of strategies that are going to change the fact that parents drink at high school football games. And if we do that, we should see those police reports change and we should see those youth focus group change. And if we're able to do that, it's going to impact favorable attitudes, because if parents are getting in trouble for it, they're being told it's wrong. It's going to eventually change the thought bubble of that it's okay to be doing it, which will change their perception of risk and parental disapproval, which will eventually change underage drinking. That's the domino effect we want to see. So again, as we're going back, if you have a logic model, this is how you can go back and critique it. And every lens we should be using. Do we have data included for the problem, root cause, and local conditions? These 2 pieces. That those data are a mix of quantitative and qualitative as part of that. That our local conditions, again, are specific, identifiable, and actionable. And that it has line logic, which means we can read it right to left and left to right. What do I mean by that? That I can say underage drinking is the problem. It's the problem because parents have favorable attitudes. And we know that parents have favorable attitudes because they're drinking at high school football games and they're hosting graduation parties. So that's moving left to right. Then we can also go the other way and say parents are drinking at high school football parties, which shows they have favorable parental attitudes, which is impacting our underage drinking. It has to make sense in both directions. Again, because the idea here is if we get really good at this, we have a set of strategies that's going to directly impact that local condition, which will change the favorable parental attitudes, which change underage drinking. We want to be able to pull that string all the way through. And this is where I told you at the beginning, I would have my logic models up over my desk and I would say, if we're doing a strategy and it's not impacting our logic model, why are we doing it? You either need to change the logic model or we need to change what we're doing, because everything we do should be hyper-focused on that. Now, if you have a new drug trend, that's great. I'm not saying don't do it, but I am saying you should probably have a logic model to do it, so that we can make sure we're having that aligned impact, because that's really what this is about. Underage drinking is a huge beast of an animal to take on and change. This allows us to unpack it and show where we're really having impact. And that as we're changing parents drinking at football games, as we're changing parents hosting graduation parties, we're going to take on another local condition that slowly is chipping away at parents thinking it's okay. And again, this goes back, if we take it out of substance use realm and thinking about it in terms of safety and seatbelts, it took a long time for people to be like, I think I was scrolling for Instagram and something came up about being allowed to drink in your car. So open container. And it was like a video from the 80s. And people were like, why are you telling me I can't drink in my car? One of them was a woman drinking a beer in her car with her toddler in the front seat, because that was a lot at the time. And she's like, I should be able to do what I want in my car. I mean, we're hearing this with cannabis. Other people are like, why are you stopping me from having my road beer after my long day at work? All this stuff. And I just remember thinking, oh my gosh, how far we've come. Like now, most people will not drink with an open container in their car because they know it's not okay. They know they're going to get in trouble with, because we've changed that favorable perception that it's okay, right? It takes time to do it. What we're saying is that if we get enough of these local conditions and we change them, we're going to chip away at that thought bubble, that favorable attitude, and it's going to overall change the drinking rates. So again, what does it mean to make sure we have the right data? So this is taking what we would call one line of logic out of a logic model. So a problem statement, a root cause, and one of the local conditions. Here we're looking at underage drinking. So the problem is underage drinking. So 39% of 8th through 12th graders report use of alcohol in the last 30 days. And we get that from the ABC survey in 2019. 32 citations for minors in possession in 2019 for the ABC department. Do both of those data points prove that underage drinking is a problem? Yes or no? Both of
Can
those
you repeat that?
Yes. So for data point 1 and 2 under the problem statement, we have a 30-day use rate and we have citations that, minors got in trouble for having alcohol. Do both of those tell me that we're having an issue with underage drinking?
Yes.
Yes. And that's what we want to ask ourselves as we go through. Do both of the data points we're mapping tell me we're having that problem? And so then we do that, the same thing with availability of alcohol. 46% of 8th through 12th graders report alcohol is easy to get. That tells me that we're having an availability issue. And then the second one says youth report alcohol can be easily obtained. That comes from the focus group. Both those say availability is an issue. And then finally, we're saying, but why here? Retailers are selling alcohol to minors. So 15 of the 60, 25% of retailers failed compliance checks. So that tells me, yes, retailers are selling. And that of those 32 use from that first data point we saw under the problem statement that were cited for minors in possession, they said to the police, I got it from a retailer. So all of these are backing up what we're putting in the box, because that means if we go and do a set of comprehensive strategies, training retailers, having more compliance checks, whatever you're doing around retail access, and it changes the fact that we're having so many people fail compliance checks, and we're seeing that youth are no longer saying they can get it from retailers, we should see a decrease in the availability of alcohol, which will change underage drinking. It becomes really important to map the right pieces of data so that when we get strategies in place, we see that data change, because this is you building your evaluation plan. Going back to your building your evaluation plan, this is where your objectives end up coming from. And that's why this is such a foundational piece, and why the assessment part of the strategic prevention framework is so important, because you're collecting that data and then building this logic model that the local condition data underneath there becomes your short-term objectives. And that's why I said we really want to make sure we have data there that we can collect more readily than every 2 years, because we want to see those local conditions change within 6 to 24 months. And if we want to see them change within 24 months, we need to be looking if they've changed before that, right? Then our intermediate objective that we're going to be saying we're going to change under root cause. So if this is availability, we're expecting to see that change in 1 to 4 years. And then finally, when it comes to our problem, whether it's alcohol, cannabis, what have you, we're expecting that data to change within 3 to 10 years. And again, the idea here as we get into the next session and start talking about strategies is that we have these comprehensive strategies all working together that are going to impact that local condition, that are going to change that root cause, that are going to finally knock over the problem. And so here, this has it with the actual information. And if we have parents hosting graduation parties with alcohol, and we do this set of strategies, we should see the police reports and interviews change. We should see their favorable parental attitude change and the underage drinking change. You're setting yourself up for how you're going to prove that you're moving the needle. What I can say is a lot of times you're doing so much of this work already, you're just not aligning it for its most impact. That's what I tell people. They're like, am I starting from scratch? And I'm like, you're absolutely not. But I can tell you there's probably holes that you could be filling in, gaps that are going to get you more impact to moving the needle quicker. If we were mapping the right data to it, if we're making sure our local conditions were really strong, all of that is going to get us into having better outcomes because we're matching what we're doing to the right data pieces. I like to think about this as tug of war when we're starting to think about the logic model and pulling it over. Dominoes work, but also tug of war as we start talking about, we're going to put strategies. The idea is that all of these things are working together to pull over the issue, to change it. And if we have one of these people pulling in an odd direction, we're not going to have the same impact, right? And so the idea is, like I said, you're doing all of this work. You guys are working so hard. All I'm saying is we can align it in an even better way if we get the right data and we have the right things in the logic model. It allows us to all be pulling in the same direction. I love my metaphors. Okay. It just helps me. It helps me know why we're doing this, that it isn't just something we're putting on paper because funders told us to do it, which I know that might be some of the reason you're doing it. It really is a tool that we can use that can showcase all the hard work you're doing is having the impact you say it's going to have, and not just waiting to put into DFC-Me the core data that is 30-day use data, that we can really show these changes happening in the local conditions and the root causes while we're waiting for those bigger data changes to happen in the problem. So I want to go back to local conditions because this is so important. And it's something that, like I said, I struggled with the most in terms of unpacking. And I don't really like the word poor local condition. It's something we've used, but for me, it's not poor. It's that we need to unpack it more. And so this gets, again, for us to aligning and getting our local conditions into digestible pieces so that we can get the right data to back it and put it in the right place. So we've already talked a lot about this one, but a local condition that needs to be unpacked more is one that's still in the thought bubble phase, right? So youth don't think marijuana is harmful. Heard that already several times. So the problem is when we get to strategies and we're thinking about having impact is that then we just are going to provide education to youth that on the dangers of marijuana. It kind of limits us, right, to having that overall impact we want to have for that domino effect. But if we unpack that more and said, youth don't think marijuana is harmful, so what is the behavior we're seeing? Well, here we see youth vape marijuana and other substances in the parking lot at lunch. So this allows me, I'm not saying don't provide education. We can provide education, but we're also going to enhance and monitor the parking lot at lunch. We're going to be updating procedures and train school staff to address students who are high/drunk in class. And we're going to update the school policy to include vaping/e-cigarettes. It allows us to really get down into how we can impact that thought bubble. Because again, that thought bubble is being addressed in the root cause. And so if we're able to do all these strategies, we're going to have that tug of war where we're going to be able to, they're going to stop being able to vape in the parking lot, which is going to make them understand that at the very least, we think it's not okay and it's risky for them, which will impact their substance use. Another one that comes up a lot is that drinking is a rite of passage. Alcohol is a rite of passage in our community. Again, I'm not telling you that's wrong. I'm just telling you that is true across the United States of America. And once we say something like that, it gets us straight into a strategy that is very like, we're just going to tell people excessive alcohol use is bad. But if we say, tell me about that, what's happening? What do you mean that it's a rite of passage? Well, parents and youth picnic at with alcohol at the city park during the 4th of July bash, or I'm from the land of Bonnaroo Music Festival. We have a huge music festival in which parents are using right alongside their children. That allows us to open up and saying, yes, we need this campaign, but we're also going to enforce open containers, action laws. We're going to update city permitting to process to control alcohol consumptions at events on public property. Suddenly allows us to unpack more and figure out strategies later on. So that's why I'm saying this is a roadmap. If we get good at logic models and have really strong local conditions, we're going to have better strategies, which means we're going to see that data change. Another example of this, again, comes up, you hear a lot of times lack of, or there's nothing of something. There's a lack of a resource. So there's no education on dangers of drug use. And this is where I'd say, okay, because there's no education, what are we seeing? And here, they're seeing high school athletes share their prescribed painkillers with fellow athletes. So whereas before, we're just going to provide drug use and misuse education and middle and high school classes, which isn't bad. Now we can do that. And we're also going to train coaches and nurses to monitor athletes' RX use or prescription drug use. We're going to work with prescribers to regulate prescriptions and educate parents. And we're going to update policies and procedures to ensure monitoring of athletes' prescription drug use. So again, it's not that lack of something is wrong. It's just that we want to get down to the behavior that we're seeing because we don't have education, what are parents doing or what are young people doing, and getting really specific, because now we can do all of these strategies that are really going to impact high school athletes sharing their prescribed painkillers, which is going to impact their availability or perception of harm wherever it's mapped, which is going to impact the overall use. Questions or comments here? Is there, thinking about your logic models, or do you have certain things like this, or are there barriers that come up when you're trying to get to this point? As you're doing that, I'm going to put some stuff into chat for you. Those are the slide deck. So you have that. And thinking back to our cannabis problem analysis and talking about that it's not harmful. Oh, you're welcome, Laura. Now seeing it through this lens, is there anything else you would add as a local condition to cannabis use? Now that we've talked about what a really good local condition can look like. You're very quiet. Remember that this takes time to get really good at logic models. The only way you get better at logic models is to continue to do them and to share them with your friends. Share your logic models with one another, have people critique them, critique your own. Again, I want to encourage you to really think about your local condition, to go back and ask yourself, do we have the right data aligned? And is our local condition specific, identifiable, and actionable? Alice says, adding a time to the local condition. Teens are using cannabis in the, yes, thank you, Alice. The more specific we can get, the better. And so I love that you did that, because that's exactly what we want to see, because then we can pinpoint that during the bathroom time, we can have people, I mean, during lunchtime, we can make sure there's more, not enforcement, more observations, more adults around. What do we need to do to ensure that during lunch we're monitoring more? That's the word I was looking for, monitoring. So as you go back, really take the time, if you already have logic models, to go and do that critiquing of the logic model. Ask yourself, do we have the right data aligned? Do we have 2 points of data that are speaking to whatever we put in that box? Because again, a lot of times the data is really vague. And with that local condition, we want whatever we say is happening, like parents are drinking in the parking lot, it needs to say that parents are drinking in the parking lot. That way, if we do strategies, we'll see the impact on it. Same thing with like school use in the bathrooms. We want to make sure that whatever data we say, that the kids are saying that that's happening there, or that adults administration are saying it's happening there. If you're new to logic models, I want to encourage you to go back and do this informed problem analysis. And you don't need to call it that. You don't need to tell them they're logic modeling. It can be giving them pieces of data and asking them questions like I did for you. It could be having Post-its that you have up where you're saying, okay, we all agree cannabis is a problem. Why is it happening? And having them write it out on it, and you can move it around. But start having this discussion, because especially if you still need to collect data, this really helps you figure out the holes that are in your data so you can have the right data mapped to your logic model. Again, I want to encourage you to contact Coalition Development Support, CDS at .org. As you're doing your logic models, there's no better people than them. I know that you have an incredible team in Ohio that is here for you as well, but get better at logic models. I'm telling you that you're going to see more impact the better you get at them, the more you're aligning your strategies, which is going to mean more funding later on. It is going to mean more support from your community. When we're talking about capacity building across this, people want to be part of something that is showing impact. It's hard to wait 2 years to show that. So if we can really be showing them the movement we're making on local conditions, if we're working on something like price and promotion, the fact that young people on their way to school are seeing multiple advertisement, and we're able to work with local retailers to have that reduced, or we're changing bus routes so they don't see it, whatever it is, those are wins that people want to be involved in. And the two things that people want to fund are collaborative efforts and efforts that are making a difference. So if you get good here, it is going to mean more funding later on in terms of alignment. And so with that, I'll leave you with my contact information. I'm here for any questions. I will make sure again that those slides go out to Fran so she has them, as well as any other templates or tools I have around logic modeling. But now I know that I think Fran is going to drop an evaluation into chat, but I'll open it up for any questions that you might have.
Thank you so much, Christina. And I will send out the information, any information that you have, hopefully by the end of the day today. So you all should be receiving that. I just put the evaluation link in the chat. Please fill that out. Let us know how we're doing. And if that's how you will verify your attendance for your continuing education credits. So please fill that out. As usual, we have more of these training sessions coming up. So I've just put a link in the chat to the next one, which will be in 2 weeks. And it is on coalition capacity building. Christina will be back again to do that training. Thank you all so much for being here. Glad you could join us. And I hope you guys have a great rest of your day.
Yes, thank you all so much for your time and attention. I'll stay around if there's any questions come up. Thank you all.
All right. Thank you, Christina. Appreciate
Thank
it.
Of course.
My gears are like turning with these logic models. I know we have some for our programs that we use, but they definitely need to be updated. So now I'm like, ooh, I want to do them.
Yeah, I love lots. Well, I'm excited to do capacity too. It's going to be fun. Well, thank you. They're a great group and I appreciate it. I hope your kitty gets better.
Yeah, thank you. Hopefully in 2 weeks, we'll have no more meowing and he'll be out and about. So
Fingers crossed. Thank you so much.
Right.
Happy for the weather.
thank you.